You so much for your introduction. As already mentioned, I'm Salima Mehrali, and I'm Associate Professor in the Faculty of Nursing, University of Alberta. And today I'll be presenting one of the projects where we are engaging adolescents in sexual and reproductive health, which we find as a holistic and culturally sensitive strategy to address SRH in Pakistan. Adolescence is a critical period in the transition from childhood into adulthood when young individuals aged 10 to 19 years, they experience substantially physical, psychological, social, and emotional changes. Globally, many adolescents become sexually active without access to quality and gender-responsive information. Adolescents living in low and middle-income countries, they face significant challenges related to accessing sexual and reproductive health education and services. And the situation is more vulnerable for young girls and women living in hard-to-reach and underserved communities. An estimated 21 million pregnancies occurred annually among adolescents aged 15 to 19 years in many LMICs, with approximately 50% are unintended, resulting in about 12 million births. Some of the contributing factors for early and unintended pregnancies include inadequate sexual education, early initiation of sexual activity, early marriages, low socioeconomic status, ineffective contraceptive use, low education, and career aspiration. Pakistan is a low and middle income countries in South Asia, and in Pakistani society, human sexuality is often a taboo subject, which tied to strict moral values and hinder open discussion about the sexual and reproductive health. Additionally, there are prevalent some false beliefs, particularly among rural population, that unmarried individuals age under 18 years, they do not require SRH information and services. Pakistan faced significant challenges in promoting adolescent SRH, similar to many other countries worldwide. There is often little acknowledgement that adolescents engage in consensual or coerced sexual activity before marriage, and there is a misconception that providing sexual health education will lead to unwanted behavior. The available literature also suggests that adolescents in Pakistan possess little to no information on puberty and menstruation, gender equality and empowerment, and gender-based violence and abuse. Almost half of the women in Pakistan, they become pregnant before the age of 19 years, and 1/3 of these pregnancies are unintended. More than half end in abortion, which primarily carried out by unskilled providers, and 12% result in miscarriages or stillbirth. Many government and non-governmental organizations in Pakistan, they deliver programs which address various aspects of adolescent SRH, like, for example, contraceptive use and SRH literacy, and in different settings like schools and health facilities. However, these have been implemented mostly in urban areas and cities. Many of the organizations working in isolation from one another, and very few have comprehensively evaluated their programs using rigorous methods. And there is a lack of information on implementation which makes it difficult to determine what works for whom and under what circumstances. Despite these efforts and progress by these organizations in increasing the uptake of SRH services in Pakistan, adolescents in rural areas do not have access to SRH information, resources, and services. Moreover, there are no programs that engage adolescents in developing and implementing SRH and family planning interventions, which can improve the quality and responsiveness of SRH program and policies. Meaningful adolescent engagement in research, which uses young people's ideas, expertise, experiences, and perspectives throughout all the levels and stages of programmatic, policy, and institutional decision-making. And this is especially true for the programs that directly affect their lives, such as SRH and access to family planning and services. The evidence base suggests that meaningful youth engagement could significantly enhance SRH-related programs and advocacy issues, change community attitudes toward youth SRH, it reduces its stigma associated with youth SRH, and increase awareness by policymakers and health providers. Despite the importance of meaningful youth engagement in SRH and family planning advocacy projects, many programs and policies in Pakistan are based on perception of what is considered proper or best for young people rather than actual needs. So to address this gap in this project, we are engaging adolescents and youth to develop a culturally relevant and easy to use SRH and family planning advocacy toolkit to enhance the uptake of evidence-based SRH and family planning information and services among adolescents in rural Pakistan. By engaging adolescent boys and girls, we will develop and co-design a toolkit with adolescents to ensure its usability and effectiveness, addressing the gap in existing toolkits that have not involved young people in their development and fail to meet their specific needs. The first step of this project is to establish adolescent advisory groups for meaningful engagement in all the phases of this project as a team members. To recruit adolescents for the adolescent advisory group, we collaborated with lady health workers to identify active young male and female participants aged 15 to 24 years to ensure inclusive and meaningful engagement with their peer group within their communities. Lady health workers, they mapped out the adolescent population in their catchment areas and invited participants to join adolescent advisory groups. Separate age and gender groups are established, and these young advisors, they first receive training in research methodologies, sexual and reproductive health, and social determinants of health to empower them as active contributors. After comprehensive training, these advisors then initiated sexual and reproductive health and rights sessions within their communities among peer groups. They target adolescent girls and boys, and they have conducted sessions with them on various SRH topics such as menstruation and hygiene, early marriages, early pregnancy, gender-based violence, decision-making, effective communication, education, and empowerment, and family planning as well. And the purpose of these sessions are to develop a priority list for our toolkit. In 1 year time, we have recruited 15 youth advisors or adolescent in our adolescent advisory group, and they are working closely with the project team and community. Initially, the youth advisors, they face significant challenges in gaining permission from parents and guardians to interact with their children for the sessions. Parents were concerned about the sensitivity of the topics, which will be discussed, especially SRH-related topics. However, through continuous efforts and determination to empower the community, these youth advisors successfully recruited participants by involving parents in the session and explaining the benefits. Approaching young people by their community within the same community proved easier, given the inherent cultural understanding and familiarity among community members. Despite initial challenges, the youth advisors achieved success in less than a year. They even able to persuade the family to delay or cancel marriages in favor of education and health. The success stories in a less than 1 year of the time, it underscored the impact of their efforts from preventing child marriages to empowering young girls to prioritize education. However, they acknowledged the need for continuous guidance and support through training and capacity building workshops. So looking ahead, the youth champions, they expressed their unwavering commitment to continue their efforts, emphasizing the importance of ongoing education and community involvement. They also provided valuable feedback on improving the SRH toolkit and program, which recently we are working on. And they are participating actively in the co-design of the toolkit to better address the needs of their communities. By empowering young people to take an active role in educating their peers, this project will contribute to improve SRH knowledge and awareness in rural communities, where access to accurate information and services is limited, fostering a positive impact on adolescent health and well-being. This picture has recently been taken when I visited Pakistan last month, and these are our youth champions who are participating actively. They are conducting sessions with young adolescents in the communities, identifying the priority list for our toolkit, and supporting us in co-designing the toolkit. At the end, I would like to acknowledge our team members for this project. These are the references I used in this presentation. Thank you so much.